morning everybody. I am Dr. SIVABALAN, cardiologist from Hindustan Hospital. Today I am going to tell something about pulmonary hypertension. Pulmonary hypertension is a complex and often misunderstood disease. In India, about 1.3% of our population has pulmonary hypertension. Pulmonary hypertension is defined as a rise in pressure in the pulmonary blood vessels. Usually the pulmonary mean arterial pressure is less than 25 mm of mercury. If the mean pulmonary arterial pressure is more than 25 mm of mercury at rest or more than 30 mm of mercury after exercise, we call it as pulmonary arterial hypertension. What happens in pulmonary arterial hypertension? The pulmonary blood vessels are damaged, narrow and become very stiff, so that the right-sided chambers of the heart work harder to pump blood through the pulmonary blood vessels. WHO classified pulmonary arterial hypertension into 5 groups. Group 1 again subdivided into idiopathic, familial and associated diseases. Group 2 where the pulmonary hypertension is secondary to left side heart diseases like myocardial infarction or left-sided valvular heart diseases. And group 3 is due to lung disorders like COPD, bronchial asthma, interstitial lung disease and sleep apnea. Group 4 is due to recurrent pulmonary thromboembolism, that is formation of blood clots in the pulmonary blood vessels. And group 5 is due to rare disorders like sarcoidosis and schistosomiasis. So what are the symptoms of this pulmonary hypertension? We can just remember the mnemonics blues. B stands for bluish discoloration of lips. L stands for lightheadedness, especially after physical activity. U stands for uneasiness in breathing with or without physical activity. E stands for edema of legs and abdomen. And S stands for syncope. So we just remember the mnemonics blues. So how do you treat? The first mainstay of treatment in pulmonary hypertension is fluid and salt restriction, followed by conventional medical therapies like calcium channel blockers, especially diltiazem. Diltiazem causes vasodilator effect in the pulmonary blood vessels, thereby to some extent it reduces the pulmonary blood pressures, followed by digoxin, which helps to pump the blood into the pulmonary vasculature. Then diuretics to remove excess fluid accumulating in the body, thereby reduces the burden on the right-sided chambers of the heart. Then anticoagulants, either vitamin K antagonist or novel oral anticoagulants, can be followed by a specific therapies. We have a group of drugs which specifically used for pulmonary arterial hypertension, like endothelin receptor antagonist. We have bosentan, ambrisentan and macitentan. Then phosphodiesterase 5 inhibitors. Phosphodiesterase 5 inhibitors, it helps the lungs to produce more of vasodilating substances. Example, we have sildenafil and tadalafil. Then soluble guanylate cyclase stimulators like riociguat. Then we have prostacyclin analogs, which can be used as by orally, by inhalation, by subcutaneous injection and by IV therapy. So any patient come with breathlessness, don't treat them just like an asthma or COPD. Evaluate them completely, find out and diagnose pulmonary hypertension at the early stage. Though pulmonary hypertension is not a curable disease, if it diagnosed very early and treat them appropriately, we can improve the quality of life and longevity of an individual. Thank you.